Bishop, let me turn to you and see if you're ready.
Yes, I'm ready. Good
Okay.
afternoon, everyone. My name is Patricia Bishop. I am the president here at Greenleaf Midrise family. I also have a role with Rhonda Hamilton and NERAC in environment racial. Um, I ask that community health monitors considers harm with all the redevelopment because our health is very important here in Southwest. How we need polluters to remove from Southwest. Like we have suffered so much of an impact of redevelopment here in Southwest, where our health has been taken advantage of in this community. We need the monitors placed throughout the community for a better reading of what is going on in our neighborhoods. The harm that this has done already is caused sinuses problems, allergy problems, asthma, COPD, and other harm to the community. This is why this is needed, and if it's possible, that whoever is doing the digging or causing the unhealthy environment here in Southwest, that they first come up with a plan to not only just provide filters, purifies, but the filters also. And monitoring so far has shown us that there is a poor health quality here in Southwest. Thank you very much.
Thank you very much, Ms. Bishop. Great to hear from you. Let me see, Chris
Can
Williams.
you hear me okay?
Yeah, Mr. Williams, we can hear you now. So if you're able to go, I'll turn to you next.
Yeah, I am. Thank you. My testimony draws from public health economic analysis to understand the potential impact of the Environmental Health Justice Bill, which has major deficiencies. I would first like to provide the context for my testimony. When DC Council debated and approved the comprehensive plan in 2021, it should have required the mayor to submit an environmental impact assessment as is law. For nearly 20 years, the executive has proceeded with acute gentrification and urbanization that have harmed communities, particularly Black and low-income communities. The last environmental impact assessment in 2006 spanned over 300 pages. Southwest has uniquely become a constant construction zone wherein we are paying the cost for gentrification and displacement policies with our health and erosion of neighborhood livability. For more than a decade, we've asked for something to be done about the cumulative adverse impacts of industrialization and redevelopment. In the preceding decade, the district has done exactly what it wanted to do with intense redevelopment and ignored the bigger picture of environmental racism and community and ANC 60 concerns. This bill does not at all address the adverse impacts of redevelopment. As I wrote to council several months ago, DOEE has data substantiating that nearby construction is a major source of elevated blood lead levels in children. The district cannot pursue both gentrification utopia and make environmental justice achievable. Council routinely does not hold the executive accountable for what the law says. Much of what is in this bill advances what would have been captured in the environmental impact assessment that I mentioned earlier. Much of what this bill advances already covers many existing laws, particularly on point source mitigation, but DOEE has poorly implemented district laws seeking, in effect, deregulation and for polluters to regulate themselves. In Mr. Allen's ward, buildings have been constructed on highly contaminated land near vulnerable communities without any DOEE mandate for mitigating harm. For more than 3 years, the government has not satisfied my FOIA request on district monitoring of the Audie Field Voluntary Cleanup Plan. DOEE has not produced a final report on compliance and monitoring related to Audie Field. My major point here is that the bill will absolutely not work based on the current underperformance of DOEE. Several revisions are needed for this bill. The bill allows for the executive to use ward-level comparison. That language should be eliminated to ensure environmental equity across the district. The bill should call for removal of current sources of environmental injustices rather than give the executive any more latitude, which it has abused. The district's completed environmental assessments should be instructive. In the Department of Health Office of Health Equity's Chase report, they claim that the community's current vulnerabilities would mean that construction of Audi Field would have a negligible impact on communities. In other words, the community already had too many vulnerabilities. This bill would make little difference in how the district conducts environmental impact assessments and therefore have little impact on turning a corner on environmental injustices. The bill needs more to convey an understanding and to affect the public health economy around environmental health. Thank you.
Thank you very much, Mr. Williams. Next, just a couple of quick questions, I think. To Mr. Williams and Ms. Bishop, I was going to start with you if I could. You may have heard of my discussion on one of the earlier panels. One of the witnesses raised what I think was a very valid point, which was there's an inherent conflict that is going to take place between an action that would be taken by the government and then an analysis of cumulative impact that would be done by a government entity. And so from a trust and confidence perspective, what I was asking her is, are there other ways that we've seen other jurisdictions or other places that can allow that analysis or that evaluation to take place that gains confidence of community that all too often has a rightful distrust of government and decisions being made because there's been so much cumulative impact there. Just wanted to ask your thoughts on what do you think this legislation would need or ways that natural conflict could be addressed in a way that builds trust with community, and especially the communities that have suffered the disproportionate impact of bad decisions over the years.
Yes, I'm happy to go first, unless Mrs. Bishop would like to go.
No, go ahead, Mr. Williams.
Okay. Well, I have a couple of points. One is that we need to depoliticize these assessments. What I attempted to illustrate in my testimony was that we have not just underperformance, but we have government policies and oversight regulation that is not really looking after the public interest. And where we have asked for these assessments, as with the Chase report that I recommended, the findings were underwhelming, and there was almost no follow-up in terms of the ways in which the community has been surrounded by acute redevelopment and related activities such as construction, such as higher vehicles in the area due to tourism and the like. And so I think it's absolutely vital to make any cumulative impact assessment to be nonpartisan and to be independent. I think that the Council Office on Racial Equity has done a remarkable job in providing council with important information for proposed legislation. Of course, the kind of independent agency that I have in mind would be under the executive branch, but certainly there is a way to make that agency independent. And I think that that's absolutely vital. So that's the first point. The second point is that we need to strengthen the language to accelerate health equity, environmental justice, by deindustrialization. So as you know, Mr. Allen, part of the rationale that we were told in Southwest for why these polluters needed to stay in the community was because they produced ready-made concrete, and in the last 10 years, this ready-made concrete needed to make its way to gentrification hotspots in Southwest, Navy Yard, and downtown. In order to get to environmental justice, we are going to have to make some choices around how we build our communities. And in part, I think what that means is that we can't continue to concentrate all of this redevelopment in and around Southwest and downtown. As the comprehensive plan lays out, we've got to really begin to redevelop in other hubs in the city. So those are, I think, two major points that I would make related to that.
Thank you, Mr. Williams. I appreciate that. It's helpful. Ms. Bishop, next, let me turn to Sacoby Wilson.
Hello, everybody. My name is Dr. Sacoby Wilson. I'm a professor at the Maryland Institute for Applied Environmental Health. I direct the Center for Community Engagement, Environmental Justice and Health. I'm really excited to be here today to give testimony about this bill. Really strongly support the bill. I am part of the EPA Science Advisory Board. And as part of the EPA Science Advisory Board, I'm a liaison to NEJAC's Cumulative Impacts Working Group. NEJAC is the National Environmental Justice Advisory Council. So we've been meeting to talk about, the issue of cumulative impacts at the federal level and integration of cumulative impacts into EPA's program and regulations and initiatives. At the state level, I'm a member of the Maryland Commission on Environmental Justice and Sustainable Communities. We've been also talking about the issue of cumulative impacts in the state of Maryland and trying to push cumulative impacts bills. So this issue is really important. As you see from the bill, it uses as a template the New Jersey's cumulative impacts bill. That's one of the first cumulative impacts bills that was passed in the country. There have been other cumulative impacts bills that have been passed in other parts of the country, including in Minnesota, Colorado, California. In addition, in the Eastern Seaboard, we have Massachusetts, New York also. So the issue of cumulative impacts is very important. When we think about environmental justice, we know historically we're talking about communities that have been disproportionately burdened by environmental hazards and locally wanted land uses. And so if you look in DC, as Patricia already mentioned, there's some facilities, some differential impacts that have occurred from mobile stationary sources in Ivy City, Brentwood, and also in Buzzard Point. So you can look at facilities like power generators. You can look at small auto body shops. Look at also at parking lots, as Patricia mentioned, when you have DC related vehicles. Those impacts to the air, water, and soil are very important. Right now, if you don't take into account the cumulative impacts, you're basically looking at things one facility by facility, and communities don't experience one facility at a time. So from a public health perspective, you really want to bring in cumulative impacts and understand what are those health impacts. So the requirement of a cumulative impact assessment when any new operation is being permitted or thought about being permitted is very important. Also, you want to do as part of the cumulative impact assessment, not just the current source, but what are the current health impacts? So what's the current health status of the population where the operation will be placed, right? And any health disparities as well. So it's important to make sure health is it's part of our cumulative impact assessments. And also from a process perspective, environmental justice is very much about the community voice in the process. So we talk about representative justice. So if you know the 17 principles of environmental justice, principles 5 and 7 talk about self-determination. So any process to bring new operations in have to involve the impacted population. So that's representative justice. Now, from a distributional justice perspective, when we think about cumulative impacts, we talk about the negative cumulative impacts, but the positive cumulative impacts as well. So when you think about communities that have been overburdened, we need to think about investments. So right now, if you look at in this country, we have a lot of resources out there through Executive Order 14008, that's known as President Biden Climate Change Executive Order. As we move from a dirty energy economy to a clean energy economy, 40% of those benefits, the federal investments should go to disadvantaged communities. How are we making sure that these communities who are experiencing cumulative impacts also get the investments, also get the co-benefits when it comes to addressing climate change, greenhouse gas emissions, when it comes to addressing urban heat island issues? That has to be a part of this bill, the framing as well. The dollars through the Inflation Reduction Act to solve the problems, the dollars through the bipartisan infrastructure law to solve the problems, any dollars from fees related to operations, facilities, emissions in those communities should also be included in this bill. I'm a proponent of having a new office, NDOEE on environmental justice, but every agency in DC should have an EJ office. Every agency in DC should have an EJ plan. As Patricia mentioned, I'm also a proponent of amendment for an interagency council. At the federal level, we have the interagency council where all the federal agencies come together to talk about environmental justice. We need something similar in DC. Additionally, I'm a proponent of using mapping tools to be able to identify, prioritize, and market target those communities with solutions who are experiencing cumulative impacts. The CDC EJ Index tool is a tool I believe is the best tool, but DC should build its own tool as well. So in closing, there are a lot of good points to this bill, but the moment's now to advance environmental justice in DC. Thank you.
Thank you very much, Dr. Wilson.
Dr. Wilson, I wanted to come to you. What existing health conditions in the community are most important for us to consider in a cumulative impact process?
Yeah, thank you for that. When when communities are experiencing environmental injustice, you can look at the sources of hazards, you look at the emissions. So we talk a lot about greenhouse gas emissions in perspective of climate change, but we're talking about co-pollutants that are important. So if you have a lot of buses moving through a community or DC-related vehicles moving to a community and they're burning gasoline or diesel, the co-pollutants of concern are, particulate matter, nitrogen dioxide, sulfur dioxide, volatile organic compounds, and also black carbon. All those pollutants can contribute to short-term and chronic health outcomes. So you can have asthma, heart disease, elevated blood pressure. Also, many of those pollutants are mutagenic, so you can mutate DNA. Some of them have reproductive impacts, right? And also development impacts. Same way that lead has an impact on the development of kids, some of these pollutants also have a development of kids. So it's not just the respiratory or cardiopulmonary impacts that we should be concerned about, but very, very important. But there's another set of non-respiratory, non-cardiopulmonary outcomes that should be considered. Now, when it comes from public health, when we track well, we track asthma well, right? We track heart disease well. We track stroke well. But there's these other morbidity measures that we should be also tracking. So when you think about cumulative impacts, it's just not the hazards, right, that we need to be tracking. The impacts themselves, the negative impacts themselves, from a health perspective. Asthma is the biggest one, as you've heard in previous testimony, but there are many others that communities may experience that should be tracked better. And so, just to say this and pass the mic back, the Department of Health needs to be engaged in this to making sure that they're tracking health outcomes in communities that are overburdened. So you actually have good baseline data, and when it's policy implemented, you can see changes, positive changes over time.
Really powerful. My time is ticking, but